All right, good afternoon. I am Alana Clark-Kirk. I'm the Education and Communications Manager at the Health Policy Institute of Ohio. Thank you for joining us for our webinar, Connections Between Pretrial Incarceration, Community Safety, and Health. HPIO is an independent, nonpartisan, nonprofit organization. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending. We'd like to thank the Ohio State Bar Foundation for their unique contribution to this project, as well as our core funders who advance our mission with their steadfast investments in our work. We'd also like to thank our 2022 Educational Event Series sponsors who thank you for their generous support of our webinars and forums. We encourage you to tweet throughout today's webinar using the hashtag HPIO webinars to continue the conversation on Twitter. If you have questions for us today, please type them into the questions box or use the chat. We will read as many questions as time allows. Nick Wiselogo from our team will be dropping links and keeping an eye on the chat. We will have a few poll questions at the end, so please stick around for those. Today's presentation slides, a recording of this webinar, and other related resources will be available on the HPIO website. You'll find those by clicking on the Events tab. Thank you again for taking time out of your afternoon to be here with us today. Haley Aka, Associate Vice President at HPIO, has been with the Institute since 2015. She leads our criminal justice and health work, as well as many other projects. With that, I will turn it over to Haley to share findings from the brief.
Thank you, Alana, and thank you all so much for being here. Like Alana said, my name is Haley Aka. I am just so happy to be with you this afternoon to talk through the key findings from our latest brief on the connections between criminal justice and health. We'll start our conversation here with this pie graph that describes the modifiable factors that influence our health. When we think about improving our health, a lot of us think about our health behaviors, right? How we eat, how we move, how we treat our bodies. And we see here that our health behaviors represent about 30% of the influence on our overall health. We might also think about our interactions with the healthcare system, which makes up about 20% of the pie. But on the right in dark blue, we see that 50% of the influence on our health comes from our social, economic, and physical environments. These are the conditions of our communities, our housing, our transportation, our employment opportunities, as well as any experience we might have with the criminal justice system. So in order to improve health, we need to pay attention to all of these factors, including the communities that we live in and the policies, systems, and structures that give people a fair chance at a healthy life. Today, we're going to explore some of the connections between criminal justice and health, which we see laid out in this framework. And for more of these broad connections, you can see our first overview brief here on the left. We've also produced a brief on the barriers to justice for people of color. You can see that in the middle here. But today, we're going to discuss research from our latest policy brief, which focuses on pretrial incarceration and the money bail system. These are our three key findings from that brief. We're going to look at each of these in more detail. But before we do that, let's spend just a few minutes defining and understanding the pretrial process and the money bail system. The pretrial process is everything that happens after a person is charged with a crime and before the case goes to trial. During this period, the person charged with the crime is called the defendant because they're going through a legal process to defend themselves against those criminal charges. Another important aspect of the pretrial process is that the law assumes that the defendant is innocent. It's the prosecutor's job to prove beyond a reasonable doubt that the defendant is guilty. The second step of this process is a hearing called an arraignment. This is when the defendant is sort of formally informed of the charges against them, where the defendant enters their initial plea, and this is where the judge sets the trial date and the conditions for bail. Bail in general refers to the conditions that a person must meet in order to be released from jail before their trial. Money bail is just one type of bail condition, but there are others. On the least restrictive end, unconditional release is when the defendant is released from jail with just the promise to appear for a future court hearing. The next is conditional release or supervised release, where the defendant is released from jail, but they're being supervised, either by a case manager or electronic monitoring or some other method. Money bail is when the defendant can only be released from jail after a payment is made. This payment is called a bond. And when the defendant can't afford to pay their bond, they remain in jail while they go through additional hearings and await their trial. Preventive detention is the most restrictive type. It's actually the absence of a bail requirement. Defendants on preventive detention have been deemed a threat to the safety of others and are being held in jail to await their trial without any conditions of release. There are two primary purposes for money bail specifically. And as a reminder, criminal defendants have not been convicted of a crime. They've been charged, and they're at the beginning of this pretrial process. So the first historical purpose for money bail really was procedural. It was to ensure that the defendant came back for their initial court hearing. The idea is that you pay some money to be released, you get that money back to you after that hearing, and that will ensure that you come back. However, what the research shows us is that even when defendants are not required to pay a bond, the majority of people, as many as 90% of people in some places, do return for those court hearings. Over time, a second purpose of money bail has emerged related to safety. Money bail is now also used to hold people in jail to prevent criminal defendants from harming others while they wait for their trial. Interestingly, research also finds that people who are released pre-trial are pretty unlikely to engage in violent crime. In a study where all low and moderate risk defendants were released unconditionally pre-trial, an evaluation showed that less than 1% were rearrested for a violent crime. So instead of making big progress towards those two purposes, here's what we see as the outcome of our money bail system. In June 2018, over 12,000 Ohioans were incarcerated pre-trial on a single day. That number grew from June 2016 to June 2018, which is the last time this data was reported. Again, these numbers represent a single day in each of these years. And overall, it's estimated that approximately 150,000 people are booked into local Ohio jails every year. As we see in the circle on the right, more than 61% of people in Ohio jails are being held pre-trial, meaning that most people in jail have not been convicted of a crime. There are also major costs associated with the bail system. Ohio taxpayers pay $266 million every year to incarcerate defendants pre-trial. And due to unjust biases, policies, and structures in the criminal justice system, bail amounts for Black defendants are significantly higher than for white defendants. So with that background on the system, let's look at our first key finding from the brief, which is that pretrial incarceration leads to negative outcomes for Ohioans, their families, and communities. We know that jail incarceration is bad for individual and community health, and pretrial incarceration really just exposes more people to these effects. Jails are often overcrowded, and people are exposed to violence and illicit substances while they're incarcerated, in addition to just infectious diseases and those things that come with overcrowding. While in jail, people experience disruption in medical care, like difficulty receiving needed medications, and there's an increased risk of overdose after folks are released. Because this pretrial period is relatively short, it can be anywhere from several weeks to a year or more, people churn in and out of jail and back into neighborhoods. And these folks are coming back to communities sicker, and exposing others to infectious diseases and other concerns related to poor health. Research also finds that community safety is negatively impacted by money bail. While it's true that defendants incarcerated pre-trial can't commit crimes in the community while they're being held, research finds that the threat of incarceration does not prevent crime, and having been incarcerated does not prevent people from committing future crimes. In fact, research has found that when defendants are incarcerated pre-trial, they're more likely to commit a crime in the future. In general, most people who are being incarcerated pre-trial have been charged with a nonviolent crime. In 2020, a study of 4 Ohio counties found that 63% of people being held pre-trial were being held for a crime that did not involve contact with another person. On the other hand, it is rare that a defendant released pre-trial will commit a violent crime. Remember that national study we just talked about that found that less than 1% of low and moderate risk defendants are rearrested for a violent crime during that pretrial period. And as more states minimized their use of money bail and released more people pre-trial, national research has found that no jurisdiction has seen a really meaningful increase in crime. Rearrest rates for people on pretrial release have either increased very slightly, which can happen for many reasons from year to year, or there's been no significant change. So what this research tells us is that there's no causal relationship between money bail and community safety. Now, we all know of stories where violent crimes were committed while the defendant was on pretrial release, or a defendant was released on bail after a violent crime occurred. It does happen. The stories of these victims matter, and the harms here are worth guarding against. What the research evidence indicates is that money bail is not an effective or appropriate way of handling these cases. So for example, in the case of the Butler County Walmart shooting this spring, the defendant was awaiting trial for aggravated armed robbery. He was released on a $200,000 bond when the shooting occurred. So here, a high bail amount was not sufficient to ensure public safety. Bail wasn't the solution, but we do have other processes that can be useful in these sorts of cases. We've seen these before, but as a reminder, conditional release is one alternative to money bail. This is where criminal defendants can be monitored through the use of case managers, electronic monitoring, travel restrictions, or mandatory programming like job training or addiction treatment. And then in cases where there is clear evidence that the defendant committed the crime and that the defendant poses a substantial risk of physical harm to other people, judges can hold that person in jail pre-trial without bail conditions where there's no release available. Pretrial incarceration also disrupts social support networks, not only for the people incarcerated, but for their families as well. When people are in jail, families are destabilized, right? And children experience trauma. There are many barriers to maintaining relationships with loved ones who are incarcerated, even incarcerated pre-trial, including transportation to the jail and cost of phone and video calls. And when parents are held pre-trial, children may be removed from their custody and placed in foster care, separating them not only from their family, but perhaps from their community as well. Sometimes family well-being requires families to be separated, which can be the case in instances of domestic violence. A current Ohio policy that acknowledges this is Amy's Law, which requires judges to consider a series of risk factors when setting bail amounts in cases of domestic violence. These risk factors are things like history of violence, mental health and substance use factors, severity of the offense, things like that. Finally, financial stability for individuals, families, and communities is impacted by pretrial incarceration. When folks are held in jail, they can't show up for work. That leads to disciplinary action. It can lead to job loss. And this is even true for Ohioans who are found not guilty of their criminal charges, can still lose their jobs. In addition to this, there are financial implications to the role that plea deals play in the pretrial process. We'll talk a little bit about that. When people are incarcerated pretrial, they're more likely to agree to plea deals. Plea deals are offers made by prosecutors to defendants, and if the defendant agrees to the deal, they agree to plead guilty to the crime in exchange for a lesser charge. So for instance, the defendant is charged with burglary, but they agree to plead guilty to trespassing if the prosecutor drops the burglary charge. By agreeing to that deal, the defendant will likely receive a lesser sentence. They can also be released from jail more quickly because they're no longer awaiting a full trial. And anywhere from 90 to 95% of all criminal cases are resolved by plea deal. And for this reason, research finds a really strong connection between pretrial incarceration, being held on bail, and defendants pleading guilty to their criminal charges. So now that the defendant has agreed to the plea deal and they're convicted of a crime, say trespassing, they're subject to collateral sanctions. These are laws that bar people with criminal records from accessing certain employment or housing or education opportunities. And this has a direct impact on the financial stability of that person and their family. Data from 2018 shows that only 2 states have more collateral sanctions than Ohio. All right, we're going to move on to our second key finding. We're hitting a lot of content really quickly, so if you want to continue to throw questions and thoughts in the chat box, please feel free to do that. We hope to have some time at the end to discuss. All right, our second key finding is that Ohio's current bail system is unfair and inequitable. The money bail system by design disproportionately impacts people with low incomes. 2 defendants with the same criminal charge and the same bond amount can have very different pretrial experiences based on their income, based on their ability to pay. Defendants with low incomes are often incarcerated pretrial, while defendants with higher incomes can afford to be released. A study from 2015 found that defendants who were incarcerated pretrial had a median income of just over $15,000 a year before they were charged. That's less than half of the median income of people of similar ages who are not incarcerated. So we see that this is impacting low-income folks most. We also know that Black people are disproportionately incarcerated pretrial, and the reasons for this are historical and contemporary injustices that impact Black Ohioans at every level of society. Here are just a few examples of the places in the pretrial system where Black Ohioans face barriers to justice. During criminal charges, prosecutors have discretion over what and how many charges they issue. And we know that Black people are more likely to be charged with 1 or more crimes after arrest than white people. In plea bargains, defendants of color are less likely to be offered reduced charges than white defendants. And then in bail amounts, where the judge has discretion, the cost of bail is often $7,000 more on average for Black defendants than for white defendants. And one of the historical reasons for this disparity in bail amounts is the Bail Reform Act of 1984, which gives judges the discretion to incarcerate individuals before trial by deeming them a threat to public safety or a flight risk. This additional discretion allowed both explicit and implicit bias to infiltrate these judgments, and as a result, both bond amounts for Black people and the number of Black people incarcerated pre-trial grew significantly. We see the impact of these barriers in our state as well. 2020 analysis found that Black people in Cuyahoga County were nearly 7 times more likely than white people in the county to be in jail pre-trial on a felony charge. If you're interested in more of the background on injustice in the criminal system and the impact on Black Americans, you can take a look at our previous criminal justice and health brief called Insights on Justice and Race. All right, our last key finding from the brief is that evidence-based reforms exist. There are some policy changes we could be making here in Ohio that would move us away from the negative impacts of money bail and increase health, safety, and well-being in our state. The first promising alternative is the presumption of unconditional release. So as a reminder, this is release from jail pre-trial with a promise to appear to future court hearings. There's no other bail condition required for the defendant. Several state and local governments, like those in New Jersey and Illinois and Texas, have expanded their use of unconditional release, and there is some evidence of positive outcomes. Evaluations of these policy changes have shown a decline in the jail population because fewer people are incarcerated pre-trial, while also showing no change in rearrest rate for people on pre-trial release. There's mixed evidence, however, on whether presumption of unconditional release increases or decreases racial disparities in pretrial incarceration. So this is something to watch for if Ohio were to take this approach. A second promising alternative to money bail is the increased use of pretrial services. So these are services that are provided by courts to help defendants appear for hearings without the need for pretrial incarceration. So things like court date reminders or help with transportation or behavioral health supports that get people through that process. Pretrial services have expanded in many jurisdictions. The examples we have in the brief are from Maryland and Washington, and evaluations show an increase in court appearance rates in these counties, as well as less pretrial incarceration with no change in rearrest rates. There are things Ohio policymakers at all levels can do to implement these promising practices. We've got a few examples here on the slide, but there are more policy options listed in the brief. So for example, the state legislature could establish a presumption of unconditional release. Some states have focused this presumption on certain subset of offenses like misdemeanor offenses or some specified crimes. Local governments can expand pretrial service programs for their county courts. That's often the level at which that happens. Courts themselves can establish a presumption of unconditional release. Our state Supreme Court did this in 2020. Courts can also consider a defendant's ability to pay when setting bail if money bail is being used. Prosecutors can refrain from requesting money bail for certain charges. They can also increase data collection and transparency related to charges, bail requests, plea deals, things in their control. In fact, it's really important that all decision makers in the criminal justice system increase efforts related to data collection, reporting, and evaluation so that we have a clearer sense of what's going on in our state. There are also things that policymakers and stakeholders at all levels can do to promote equity in the criminal justice system. So for example, we could promote the use of guidance documents that standardize decision-making in the criminal justice system, guarding against some of those explicit and implicit biases in charges, plea deals, and judgments. We could also assess proposed criminal justice policies and even current policies for racially disparate impact and then work against those. So we've seen some examples of promising practices in other states. We've talked about what Ohio could do to implement some of those things. I want to leave us with the bail policy debate that is currently happening in our state. So in June of this year, the Ohio General Assembly passed House Joint Resolution 2, which put issue 1 on the ballot for the November election. If approved by voters, issue 1 would amend the Ohio Constitution to do 2 things. It would require courts to consider public safety when setting bail amounts, and it would shift the responsibility for establishing bail conditions and bail amounts from the Supreme Court of Ohio to the Ohio General Assembly. That would mean that instead of our current Supreme Court Rule 46 being the place where bail conditions are set, it would be set in legislation instead. That's really important because in 2020, Criminal Rule 46 was updated to include some evidence-based recommendations. For example, the rule requires courts to release defendants on the least restrictive conditions that in the court's discretion would ensure the defendant's appearance in court and the safety of the community. So here we see community safety is already a consideration of the court. Rule 46 also includes the recommendation that courts release defendants on their personal recognizance, which is another way of saying unconditional release. So we've got a preference for unconditional release while also considering many factors when setting bail amounts like seriousness of the offense, risk of non-appearance, previous criminal record, and things like that. What issue 1 would do is get rid of Rule 46, propose new legislation to set these conditions, and the likely outcome of that is that we would see an expansion of the money bail system and increased pretrial incarceration. So if this issue is of interest to you, stay tuned. We're planning to put together a resource page that'll include resources and information all about issue 1. So make sure you're signed up for our email list so you can know when that resource comes out. And certainly you can head to our website now for information from the brief that I just described. There's some additional detail in there for you. And here is my contact information if you have any questions about any of that.
Thank you, Haley.
Of course.
Nick, do you think we have time for any questions?
I do have one question I was going to share with Haley very briefly. Someone asked, how do healthcare centers and jails treat the pretrial incarcerated held in jails differently than permanent prisoners? What factors most contribute to this quality or inequality? So the issue of health being received in jails pre-trial.
Yeah, it's a great question, Emily. So what we hear is that it's very challenging to get access to healthcare services, particularly while incarcerated in jail. Right? Jails are held at, or they're managed at the county level. People are there for very short periods of time, really rarely more than a year, and so there's no medical staff usually at jails, and people really struggle even to get their medications when their family is bringing them the medication. So it's quite a challenge, not only for people incarcerated pre-trial, but for all people incarcerated in jails. It's a little better in our state and federal prison systems where people are incarcerated for longer periods of time, and there's a greater likelihood that there's medical professionals on staff at the prisons. But that difference between short and long-term sentences at the jail and prison level and like funding for those systems would be the reason for the disparity there, but for all people incarcerated in jail, not just those pretrial.
Thank you, Haley. All right, if you want to move us along, as a reminder, all of the materials for today's webinar, including the brief, the slides, and a recording will be available at hpio.net on the events tab, which Nick has dropped a link to in the chat. We hope this work is helpful to you in your effort to influence policy and improve health and well-being in Ohio. There are a number of ways that you can influence policy as a private citizen and also as a representative of your organization, like providing data or analysis to policymakers, giving testimony, or inviting a policymaker to visit your organization or a meeting that you're hosting. I do want to thank you all again for joining us today. We do have a few poll questions that we would like to ask before you go, and I'm going to launch those now. So just let us know that if as a result of this webinar, if you have increased knowledge of civic responsibilities, constitutional rights, government, and/or law, please tell us how you would rate today's webinar overall, and also how likely you are to use the information to influence the policymaking process. So I'll give you a minute to do that. And then to those of you who have put any other questions in the questions box, we may be able to stay on a little after to answer those, or we can follow up with you via email as well. Just because we're running out of time here. All right. Thank you for answering our poll questions. Haley, if you move us along, I'll show you some ways that you can stay connected to HPIO on Twitter, LinkedIn, and by joining our email list that Haley mentioned. And we do appreciate you attending our webinar today. We will be hosting an online forum on October 18th. Haley, move us along and she'll show you. Yep. So you can join us for that. It'll be focused on community partnerships to improve health, achieve equity, and promote sustainable healthcare spending. You can also register for this one by visiting the events page on our website. And we are right on time. Thank you so much, everybody. If you have questions for us, we'll stick around a little bit, or we will email you responses to your questions.
Thanks all for being here.
Thank you. All right. I believe Nick has also answered some of those questions, so I think we're good to go. I'm not seeing anything else in the chat.
I think all the questions are answered, so.
Thank you.
Thanks, team.